Definition of infection. An infection is the invasion of tissues by pathogens, their multiplication, and the reaction of the host tissues to the infectious agent and the toxins they produce. So basically, the infection is the invasion of the tissues by the pathogens and their multiplications of the pathogens and the reactions of the host tissue. Host tissue means the body the pathogens enter to the infectious agents and the toxins they produce. An infectious disease, also known as transmissible disease or communicable disease. So infectious disease is also known as transmissible disease or communicable disease, is an illness resulting from an infection. So it is an illness that is results from the infection. Types of infection. So how many types of infection are there? The infections are primary infection, secondary infection, nosocomial infection, focal infection, heterogenic infection, cross infection. So next we can learn the types of infection. Primary infection. Exposure of pathogens from the first time is called primary infection. So the person which is exposed to the pathogen for the first time, it is known as primary infection. And secondary infection, new infection which occurs when host resistance is lowered by the pre-existing infectious disease or primary infection. So secondary infection is when the host resistance is lowered by the pre-existing infection. So there in the body there is pre-existing infection disease of the primary infection. So it is known as secondary infection. Nosocomial infection. It is also called hospital acquired infection. So nosocomial infection is basically the infection that is acquired in the hospital environment. It's called hospital acquired infection or cross infection which acquired into hospital or other health care setting called nosocomial infection. Focal infection. Infection at a localized site. So that infection that is produced at the localized site is known as focal infection. Iatrogenic infection. Infection to patients by activities of surgeons or physicians during medical or surgical invasion. So in the hospital there is certain activities that is done by the surgeon or physician, and that infection produced is known as iatrogenic infection. Cross infection. Infection to the patient from another infected person is known as cross infection. So you get infection from the other person which is infected, that is cross infection. Sources of infection: human, animal, environment, vectors, insects, food, water and soil. So these are some sources of infection.